Okay, we're going to get started. Welcome everyone. My name is Lori Patch. I am the Grant Project Manager with the Nevada Department of Agriculture. Today, I'm going to introduce you to Nevada's new statewide program for direct certification with Medicaid. I know we have a lot of SFAs on the webinar with various experience levels, from those of you who have been with us for many years to some of our brand new participating sponsors in the NSLP program. We have a lot of information to cover today, and I hope that you will find all of it beneficial in helping more students reap the benefits of direct certification by receiving free and reduced meals, because that's what it's all about, is helping kids. The professional standard learning codes for this webinar are 3100 free and reduced price meal benefits and 3120 direct certification. This webinar is being recorded, and the recording will be turned off after the Q&A session at the end. Please refer to the handouts that we have provided as we go through the training and use the chat box at any time for any questions you may have as we go along. We will answer those questions at the end during our Q&A session. And if there are questions that we will need to research and get back to you on, we will do that and provide an FAQ document after the webinar. Thank you. So let's get started. First, a little bit of background on direct certification with Medicaid and how Nevada became involved in the USDA demonstration project. Beginning in the 2016-17 school year, USDA Food and Nutrition Service began conducting new demonstrations to evaluate direct certification using Medicaid data in the National School Lunch Program and School Breakfast Program. In 2016, Nevada was awarded an ART grant from USDA, which has funded the statewide implementation of direct certification with Medicaid. Nevada was one of 8 states chosen to participate in the second round of USDA's demonstration project, which is to be implemented before the 18-19 school year. Thanks to the funds provided by the ART grant, direct certification with Medicaid will ensure that more children in Nevada will receive nutritious meals at school. We are implementing the direct certification with Medicaid program with the cooperation and dedication of our state agency partners. These partners include the Nevada Department of Health and Human Services, Division of Welfare and Supportive Services, which we will refer to in this presentation as DWSS, the Nevada Department of Education, NDE, and the Nevada Department of Agriculture's Food and Nutrition Division, NDA. So let's define direct certification. Direct certification is a process for determining student eligibility for free or reduced school meals automatically through data exchange between SNAP, TANF, FDPR, Medicaid, and other social services. Children determined eligible through direct certification are certified to receive free and reduced meal benefits without the submission of paper applications. Please note that FDPR data is not currently included in the data match process between DWSS and NDE and will be provided separately through Mustang to the SFAs as it is currently. There are many benefits to the direct certification match process for free and reduced meals. First, it reduces the burden on families and schools by eliminating the paper application process. 2, it increases program access by reaching more eligible students who might otherwise be missed and are not receiving meal benefits. 3, it improves program integrity by increasing student certification accuracy. And 4, it increases a school's identified student percentage without an application for the Community Eligibility Program. This does not apply to students directly certified for reduced price meals. It only applies to free meals for ISP. So what's new in direct certification? Well, today we're going to talk about Medicaid and how that fits in. So let's walk through the DC match process with Medicaid. First, DWSS identifies children meeting income and eligibility criteria for direct certification. DWSS then provides that data to the Department of Education for ages 3 to 22. Nevada Department of Education then combines the DWSS data with their student data using a data ladder matching process. Then they provide the DC match list to all SFAs through Bighorn. The Department of Education also provides technical support and direct certification list assistance to the SFAs. SFAs in local schools download the DC match list from Bighorn and upload it into their Infinite Campus platform and their third-party POS system if that applies to your SFA. Schools then provide free and reduced price meals to students. NDA fits into the picture by providing program training and eligibility support to the SFAs for direct certification, and we oversee administrative reviews and federal reporting. USDA has 7 key policies for direct certification with Medicaid. And the following information will give an overview to these policies that are required by USDA in order for the Department of Agriculture and its partner agencies to successfully implement direct certification matching with Medicaid in the state of Nevada. It is important for not only the state agencies, but also the SFAs to understand the following key policies and procedural requirements during direct certification with Medicaid's demonstration project. For more information on these policies, we have provided a handout titled Key Demonstration Policies that you can refer to. First, states must conduct direct certification for both free and reduced price meals in all SFAs that participate in NSLP and SBP. Children directly certified for free and reduced price meals are not required to submit paper applications and are not subject to verification procedures. Households directly certified for reduced price meals through Medicaid must be notified of the income level used and be offered the opportunity to apply for free meals if the family thinks they are within the income eligibility requirements. So please note, any free certification, whether it's through a paper application, SNAP, or other certifications, trumps the DC Medicaid reduced eligibility. So free trumps reduced. A child or household may not be changed from free to a reduced price due to a Medicaid match. Where appropriate, SFAs may use verification for cause on a case-by-case basis as a method to address any integrity concerns. For more information on this, please see page 99 of the current USDA eligibility manual if you have any questions. Children found eligible to be directly certified for free meals based on Medicaid only are not categorically eligible for meal benefits since they must meet an income standard. State agencies and SFAs must use automated data matching with Medicaid eligibility records to directly certify students. So if a student is on the DC match list, they're good to go. You must not certify based on a family providing a Medicaid case number or a letter from Medicaid agency. Paper applications are not accepted. So just because a child has Medicaid does not mean they are categorically eligible for free or reduced meals. This determination has already been made by DWSS based on income calculations, and the student is placed on the DC match list as Medicaid free or reduced if they are eligible. Categorical eligibility policies do not apply to certification for reduced price meals under any circumstances. Students already certified for free or reduced price meals based on an application or direct certification with another program cannot be negatively impacted by a match with Medicaid. Direct certification for reduced price meals does not impact the identified student percentage for the community eligibility provision. And for federal reporting, direct certification matches should be identified as Medicaid only when the child is not already directly certified based on benefits for another program, such as SNAP, TANF, FDPR, or other. Please make sure to refer to the Key Policy Requirements document that we have provided for more detail on these key policies. The Medicaid eligibility guidelines for free and reduced lunch are as follows. An eligible child must meet both. They receive Medicaid or live in a household with a child who receives Medicaid and has a family income as measured by the Medicaid program before expenses and deductions that does not exceed the National School Lunch Program demonstration income eligibility guidelines applicable to family size. This information is provided to explain how Medicaid eligibility is determined and why you must use the DC match list for free and reduced lunch eligibility with Medicaid. If a child is on the DC match list as Medicaid, these calculations have already been made by DWSS. For more information on this, please refer to the eligibility manual on pages 36 and 37 for more information. You are probably all familiar with the income eligibility guidelines chart shown here. This is a part of how Medicaid eligibility is calculated and determined at DWSS prior to sending the data to the Department of Education for the matching process. Medicaid, free or reduced price meals. How is it determined? Direct certification for Medicaid is based on NSLP income eligibility guidelines and is not to exceed 130% federal poverty level for free meal eligibility and 185% federal poverty level for reduced price meal eligibility. For more information on this, please refer to page 36 and 37 of the eligibility manual. I know many of you know this because you've been with us for a while, but we also have several new sponsors on board, so let's review quickly. How can a child be directly certified? Children can be directly certified through the following programs: SNAP, TANF, FDPR, other categorical eligibility sources, Medicaid free meals, and Medicaid reduced price meals. The DC match list is the only way a child will be eligible for free or reduced price meals through Medicaid. Paper Medicaid is not allowed, only the DC match list. Let's review eligibility hierarchy in numerical order of priority and with the codes we have for each program. First is SNAP, Supplemental Nutrition Assistance Program. Free benefits are extended to all children in the household with SNAP. Second, TANF and FDIPR. TANF is temporary assistance for needy families, and FDIPR is food distribution program on Indian reservations. Free benefits extend to all children in the household. Third is other. Foster, homeless, runaway, migrant, or Head Start. Free benefits do not extend to all children in the household on these other programs. Next in the hierarchy is Medicaid free. Free benefits extend to all children in the household. And then Medicaid reduced. Reduced price benefits extend to all children in the household with Medicaid reduced. So now that we know the hierarchy, let's review some important points and examples for DC match. SNAP. SNAP supersedes all other eligibility categories. Medicaid should never overlay an existing match with another allowable program category. Medicaid free and or reduced is only identified as a match when a child does not match with SNAP, TANF, FDIPR, or other sources. This is their last opportunity for a direct certification match. Let's look at an example of eligibility hierarchy. If a student is categorized as Medicaid reduced, and the latest direct certification file now has that student categorized as TANF, the student's eligibility category would change to TANF, and this would extend to all children in the household. In this example, free meals are the higher benefit level, so the family would no longer be at a reduced level, thus eliminating the 30-cent breakfast and 40-cent lunch charge if your district is collecting this charge. SFA reminders. First, let's review some important points for DC match with Medicaid. If DC Medicaid is not preceded by another program, SNAP, TANF, FDIPR, or other sources, then eligibility is extended to all children in the household. DC Medicaid for reduced price meals never overrides free meal eligibility from any source. Of course, there is an exception to this, but for that information, please refer to the Direct Certification Hierarchy by Program document. And if you do have questions, please feel free to contact us directly, and we can walk you through it. 2. Notifications. You must notify the household in writing via letter or email at any time you approve a child for free or reduced price meals. This includes when you approve them based on direct certification. They must be notified. 3. Confidentiality and disclosure. The information provided by families on free and reduced price applications will only be used for determining eligibility for meal benefits and verification of eligibility. SFAs with concerns or questions about disclosing children's eligibility information should contact the Department of Agriculture for further guidance. We are here to help you. And for more information on eligibility, please refer to pages 83 through 95 for more detail. So let's go through a visual to see how DC match with Medicaid all comes together. First, SFAs update their student information into Infinite Campus. DWSS sends the updated eligibility file to the Department of Education on the 1st and the 15th of the month. These two things can be happening simultaneously. Then, the Department of Education will take up to 2 operating days or so to match that DWSS eligibility list with the Infinite Campus Student Information System, utilizing the data ladder matching software process. Then, the Department of Education will place individual SFA DC match lists into Bighorn for download at the SFA level. SFAs upload the list into Infinite Campus and their third-party POS system, if that applies to you. And then the SFAs use the list in their POS to provide nutritious meals to eligible students. That's the whole picture. So now that we've seen the full process, let's review the DC match list update schedule. This may get redundant, but it will be drilled into your head on when you'll receive the list. First, Department of Education receives the data files from DWSS on the 1st and the 15th of the month. NDE then matches the DWSS file with the Infinite Campus Student Information System and loads the files into Bighorn within 2 operating school days. SFAs are then notified that the list is on Bighorn ready for download. And then the SFAs will import that list into Infinite Campus and their third-party POS system if you have one. Now, how do you access the DC match list? SFAs can access their DC match list at any time and should download the most current list from Bighorn twice monthly. As stated, SFAs will be notified that the DC match list is available within 2 operating days after the 1st and the 15th of the month. USDA guidelines require that SFAs access the DC match list only 3 times per year. However, in the interest of serving children, NDE and NDA recommend that SFAs access the DC match list at a minimum of twice each month. Why is DC match frequency important? First, it helps prevent schools from missing children who are eligible for free or reduced price school meals. It also ensures that children begin to receive meals promptly if they were not already certified. It aids SFA meal collection efforts, and it increases the school's identified student percentage under the community eligibility provision. This is why frequency is important and why we're committed to it. So direct certification, now what do we do? What we're going to do is break this down even a little bit further. The direct certification process can be broken down into a very few simple steps. 1, you download. Export the DC match list from Bighorn. 2, upload. Import the DC match list to Infinite Campus and your third-party POS system if that applies to you. And 3, 2 times per month. No big deal, just 2 times. That's all we ask. So now we're going to move to a direct certification list tutorial. As mentioned, twice per month, the SFAs will need to download the DC match list from Bighorn and then upload into Infinite Campus and the third-party POS system. The following slides will show what you will see as an Infinite Campus user and as a third-party POS user. For an Infinite Campus file import tutorial, we have a web address here that you will see that we'll provide after this webinar. And we also have provided handouts for step-by-step instructions on how to download and import your lists. So first, let's look at downloading from Bighorn. And I realize these are small, but you do have the handouts to refer to and SANE support to help you if needed. First, you will go to Bighorn and you will log in. Then you will click on Files, and your options may look a little different based on your user rights. Then you will click on Site Content, then FRL Direct Cert on the left. You will only have access to your district or your charter. You will most likely only see a few folders under the site content based on your access level. Then under FRL Direct Cert, you will open the folder for your SFA. For example, here we have Churchill. Then you will download the DC match list. You will click on the ellipses, which are the 3 dots, which will pull out another set of ellipses that you will click on, and then you will select Download. Save the list in your desired location. The DC match list will be provided as a large Excel file as shown here. As you can see in the pullout, students will be coded with their certification type, or DWSSC type as shown there, as SNAP, TANF, Other, or Medicaid. And then it will show their eligibility. DWSS ELIG is the column. And it will show that as either free or reduced, F or R. Please make sure that you and your third-party POS provider has a copy of the Eligibility Hierarchy document provided, and that everyone is clear on the hierarchy of the programs, and that there is also an eligibility of either free or reduced for Medicaid eligible students. Infinite Campus users. In the FRAM module, you will go to the Eligibility Import Wizard and follow the importing instructions. Infinite Campus users will eventually have the DC match list pre-populated into Infinite Campus, but for now, you will need to download the file out of Bighorn and then import into Infinite Campus. Please refer to the Eligibility Import Wizard instructions provided for the FRAM module of Infinite Campus if you need more information on how to import your DC list. Once an SFA's list is imported into Infinite Campus, you will be able to see each student's eligibility status and certified type by school year with start and end dates. As mentioned previously, once the Department of Education has done the data match of student data with the DWSS Social Services data, the file will be loaded into Bighorn for you within 2 operating days of the 1st and the 15th of the month. The direct certification list is available to you at any time, but the most current matches will be done twice monthly. So how do I know when my list is ready? Well, you can set up to get an alert. Let's go through that process. So you want to set up an alert from Bighorn to be notified when the latest list update is available. To set up an alert to let you know when the file is ready and has been uploaded, from the FRL Direct Cert folder page, click on the Files tab to drop down the ribbon, click on Alert Me, and then click on Manage My Alerts. Then you will click on Add Alert. Next, click on FRL Direct Cert and then click Next. Then choose how and when you would like to be notified. Then click OK. You will now receive an alert whenever your DC match list is ready for you to download. So now let's talk about reporting. We'll go over some key reporting reminders. First, SNAP, TANF, FDPR, and other direct certification matches always supersede Medicaid matches for reporting purposes. Identify as a Medicaid match only when a child does not match with SNAP, TANF, FDPR, or other programs. So for a visual on this, you'll see that SNAP is the top priority, then TANF, FDPR, and other, and then Medicaid. Reporting requirements to NDA will not change. The FRL report will use the data pulled on 10/31 or the last business day of October, and the report will be due to NDA on November 9th. The verification summary report uses the data pulled on 10/31, and you will complete your 3% verification process by December 15th. And the report is due to NDA in CNP as soon as possible, but no later than February 1st. The Community Eligibility Provision Report pulls data. You'll pull your data by 4/1 and fill in the data collection spreadsheet that you'll receive from NDA, and the report will be due to NDA on 4/10. With that, I would like to thank you so much for your attention and dedication in helping feed more children in Nevada. We certainly appreciate all of your time and efforts. If you do have questions, we are always here to help. Please do not hesitate to contact us. For program eligibility of a child, Rose Wolterbeek is your main point of contact at the Department of Agriculture. And for technical issues with Infinite Campus or the direct certification match export of the list, please contact the Department of Education SANE support.